What's going on, everybody? My name is John Stamper. Very excited to be with you. And I am very excited and honored to be with the Director of Clinical and Campus Education at Spear Education, Dr. Gregg Kinzer. How you doing, Dr. Kinzer?
I'm doing great. Thanks for having me on.
Absolutely. All right. So as we wrap 2023, it's crazy to think that we're already getting into 2024. We thought we would take this opportunity. I know you and your team at Spear Education are very excited about what you have in store for 2024. At campus and at the Spear Institute and all of that. So there are two courses in particular I know we're going to talk about today. Wanted to get into those and have you share with everybody the content involved, like how they're going to be able to benefit from it. And where I thought we would start is, when I think about the practicing dentist making a decision to take continuing education next year, as you know, Dr. Kinzer, it's all about how can they get their groove back, right? Like there's so many courses out there to take. There's a lot of information out there, but what course can they get into to really kind of get things going as they start the year? And that's kind of where we wanted to start, especially with this, treatment planning with confidence. And maybe we go ahead and start with that course and have you share a little bit about it.
Perfect. Way to like enter us into this good conversation. So in reality, the most important thing that we do as dentists has to be treatment planning, because for us to be successful in practice, we have to do dentistry, and that dentistry has to be treatment planned. And the treatment planning workshop has kind of always been our flagship. It's involved in everything that we do. But it's interesting if you think about treatment planning, because there's cases right now, if you're a restorative dentist, there's patients right now where you don't need any guidance, you don't need any help treatment planning, you don't need to ask a colleague. You see what needs to be done, you treatment plan it, and you do it. And if you think about those patients that are rather easy to plan, they all have things in common. So essentially, what's in common is that the teeth are in the right spot, and the occlusion works, and there's probably minimal, if any, tooth wear. And if that's the patient you're planning, the reason it's so easy is that you're really not changing anything. You're treatment planning structure. Essentially what that means is you're treatment planning the restoration of a tooth. So your choice is like, how am I going to prep it? And then what materials am I going to use? And most dentists are really comfortable treatment planning structure, because that's what dental schools do a really good job of, getting you prepared. Know how to prep a tooth, know how to restore it, whether it's composite or ceramic or a crown or a onlay. But now I want you to think about the other patients in your practice that have other things in common. Teeth aren't in the right spot. The occlusion maybe isn't working. Multiple teeth are significantly worn. And the challenge when you see those patients is the treatment planning protocols that we were taught in school now go out the window. And so most dentists get stuck and they go, I don't know what to do. So they either just monitor the wear, right? Write that in the chart, or they send it out to a specialist. And so the treatment planning workshop really is to help you understand treatment planning at a different level so you can help more patients in your practice. We get a lot of dentists who come to Spear, and they've been in practice a while. Sometimes they're brand new to practice, but the ones that have been in practice a while go, I've done single tooth dentistry my whole career, and I'm kind of just done with it. It's make a good living, but it's just really not very enjoyable. And just like you're on that hamster wheel, just bouncing from operatory to operatory and doing single teeth, couple teeth here, a single tooth there. And so this treatment planning with confidence allows you to look at things with a different set of eyes, have different conversations with patients, and know how to treatment plan those more comprehensive and more complex patients. So it's really an enjoyable workshop for me, because it's transformational in the lives of most clinicians. They've been doing things a certain way, and now we get them to see things differently, and it changes the pathway of their career. More enjoyment, more profit, these types of things.
Yeah, and when I think about this particular workshop, can you speak to where a dentist is in their career with their confidence, whether they're new out of school, working as an associate, or like you mentioned, they've been practicing for 10, 15, 20 years? Can you talk a little bit about this workshop and who it's for and how what they're going to learn could help doctors of all stages of where they are in their career?
Yeah, that's really it. You're correct. It is for doctors of all stages of their career. And what's fascinating to me is in the past, this workshop has been more like inspirational and aspirational for dentists who had been, who'd been there and done that, and they're like, dentistry kind of sucks right now, and it's just I'm having no fun, and so they want to do things different. So they've been in practice, 15, 20 years. And now the vast majority of our classes are really young dentists. I'm going to say out less than 5 years. And when you hear different people talk about it, so let's say we hear people that have taken it in the past, and then they're coming back to audit it to hear it again because we continually change things. They always say the same thing. I wish I would have done it sooner. I wish I would have gotten on this path sooner. And so they are always very happy for the newer clinicians in the room to be able to see things correctly and do things correctly kind of right from the start. So significantly supplementing the way you would talk to patients and treatment plan patients aesthetically and occlusally. So it's for dentists of all shapes and sizes and years of clinical experience. In fact, we just finished two workshops this past weekend, and we had a handful who were out probably less than 6 months, which is just fantastic because they're in an associateship and their senior clinician is helping them get set on the right foot, moving forward in their career correctly instead of make all the mistakes that we made and then have to learn it yourself. Well, let's just put you on the right path from the beginning. So it's really fun to be able to be around a newer, passionate set of dentists that's coming in right now.
Yeah, I think it's interesting. I was actually in an event last year and I had the opportunity to speak with a doctor that had been practicing for 10 years and then one, I think, was about a year and a half out. And on the break, the 10-year vet, she was speaking. She was so excited, like you mentioned, for, her colleague there that had been recently out. And it was almost like I remember her saying to me, like, she was inspired to be there and to learn, but she got even more inspiration just from seeing, like you mentioned, the excitement, for the newer dentist, and to learn, right? I mean, obviously, and then there was questions that he had for her during the break, and so I feel like that community, in addition to everything that you guys teach at Spirit in this workshop, also adds a lot of value, I'm sure.
Yeah, I've always thought of this curriculum is kind of for lack of a better term, you could say a mini pros residency, right? Because prosthodontists are restorative dentists. That's really all we are. But we do things and see things differently. So we don't just treat the tooth, we're kind of treating the big picture. And so that's kind of what we're doing in these workshops is we're giving you the ability to do more than you're doing now, or to do it more maybe predictably than you're doing now. To tackle cases, I mean, honestly, people go, I want to do full mouth rehabs. And I'm like, really? Because after you do one, you're going to go, I don't need to do that again, right? They're stressful. There's all sorts of things that can go wrong, but a lot of dentists just want to do more than they're doing now. They want to do more comprehensive care. They want to have different conversations with patients with tooth wear and know how to treatment plan them correctly and how to work with an interdisciplinary team. So that's just kind of the foundation of everything we do starts in that treatment planning workshop.
When you get the opportunity to speak with those that attended the workshop, whether it be a month after they attended, or in many cases, even a couple of weeks, we talked a little bit about being able to utilize a lot of the things that are learned and taking that confidence back to the practice on Monday morning and being able to utilize that week. What are some of the things that they say, like early on, right? Like very recent after they come back, they're in their practice, that those next couple of weeks, of some of the actual practical takeaways that they're doing right away?
Yeah, so there's really there's three main pieces to this workshop, and all three of them can be immediately applied to different degrees. So the biggest part of it is just the treatment planning aspects of it. So how do you evaluate a patient? In which order do you do that? How do you actually kind of figure out what to do? And it really revolves around visualization. So we have a treatment planning form, and that treatment planning form is something that you apply to every patient, no matter what the problems are, no matter what the complexities are. You follow the same formula, if you want to say that, to learn how to treatment plan a patient. So that's a big piece of it. In that we do a lot of photography. So to do comprehensive care, you have to have photos to treatment plan. So immediately you can see patients differently, you can treatment plan patients differently, and then the photography exercises allows you to implement photography in your practice. Another big piece of what we do is the case presentation. So talking to patients. In fact, talking to patients might be one of the most important things that we do because it doesn't matter how talented you are, right, clinically, or how smart you are with planning, if you don't know how to communicate and know how to present treatment to get people engaged in the process and not scared away, right, not feel like they're being over presented, then you're not maybe not as busy as you would hope. So we spend a lot of time with how do you now share with the patient all of the clinical findings in such a way that's not overwhelming, that gets them engaged and actually gets them to want to do the treatment that they need. So that's another big piece of it. And then there's all sorts of little pieces. I hear a lot of clinicians go, well, Greg, I don't see those patients that you see. And I always chuckle when I hear somebody say that because I said, listen, my patients are not my patients. I don't have my own patients. My patients are referred in. I have a referral based practice, which means my patients come from the offices of general dentists. So I know you have the patients. How do you filter, though, to find them? That's a key part, and that's the word we use is filtering. I don't I tell people that come to the course, I said, I don't expect you to go back and do comprehensive evaluations and these big case presentations for every patient you see in practice. You don't, you can't for two reasons you can't. One is you don't have time, and two is you have a lot of patients who just honestly they don't care. So you have to filter to find those patients that are in your practice that want more than single tooth dentistry. But you also have to be able to know how to evaluate those patients and initiate some of those conversations yourself. So there's all sorts of things that can be implemented almost immediately when you get back into practice. But that's also a challenge, right? The challenge of implementation because change is hard. Uh, it's hard for clinicians and it's hard for the staff that clinicians have in their practices. And so at Spear, we understand that. And so what we've tried to do is help clinicians implement things easier. And to do that, we put together all sorts of resources that clinicians can use by using videos that we've recorded to help explain why we want to bring this into practice. What's the benefit for our patients? What's the benefit for us as providers? And it's amazing that once the staff understands the why behind what you want to do to change the pathway of your career, they're on board and they actually help you start to solve some of these problems instead of being told what to do. They'll be engaged and they'll actually help figure out how to do some of these implementation parts.
Yeah, and as you know, Greg, when I think about any professionals that I've dealt with in my life, like confidence is contagious, right? You work with anybody that loves what they do, is very skillful, and they're very confident. love the fact that that treatment planning workshop has that with confidence, which seems just such a general statement, right? It's like, what does that mean? But as you mentioned, that confidence is contagious, and like you said, for the clinicians that may not feel like they like have those patients that you work with, as like that confidence is going to attract those types of patients, to find those practices and those clinicians. So
For
very
sure.
exciting, yeah, about that. And I the last thing on this course I wanted to ask you is it's really around the confidence piece. Is that the community that is built right for the clinicians that attend these courses? Talk a little bit about after they leave, it's the skills that they take with them and that confidence, but it's also them staying connected with the clinicians that they were in these workshops with. So is there talk a little bit about that at Spear and kind of that value piece as well?
Yeah, it's it's always better to learn with others. And what I mean by that is we've all experienced going to a meeting and you hear things at the meeting and you don't really know how to interpret it maybe or apply it to your patients or maybe even if it makes sense. So the real learning really happens that night when you're out to dinner with your colleagues and you're having a glass of wine. You're like, what the heck was that all about? And all of a sudden you start to have these great conversations. So in the treatment planning workshop, we find that dentists come with their study club and they actually bring specialists. In fact, in this last course, we had an endodontist, a periodontist, and a lab technician that
Mhm.
are learning alongside their other restorative dentists, right? So now, wow, talk about the team learning and bringing it back and applying it. It's fantastic. And then we also see people like the treatment planning workshop is typically the first workshop that clinicians attend. There's other ones that you can attend, but it's the one that kind of starts your journey.
Right.
And we try to make it easy to keep connected with your participants because so another little example, there was three different people that all went to the same dental school that were in the class. They were in the same class in dental school, but they did not know each other was going to be there. And all of a sudden it was like, wow, like I haven't seen you in 10 years.
Yeah.
So it's reconnecting. And what's neat is I tell classes this. I said you guys aren't normal, right? But you're not normal in the best of ways. You're trying to better yourself, to better your patients and your enjoyment of your career. So now you're around like-minded dentists, all learning and engaging at the same level. And to kind of keep those connections and keep going forward, we see a lot of people start to do the curriculum with other people that they had met in another workshop. So it's really kind of neat to see how the community develops.
Yeah, it's like treatment planning with confidence and a couple reunions, right? I mean, you never know who you're going to find when you come to Fair. I love that. All right, so I wanted to get into the second course of this series. So speaking of confidence, digital technology and bringing digital technology into case presentation, treatment acceptance. I know that's the second course of the series, and wow, when I think about where dentistry is now and all the different technologies and how hopefully that can bring confidence to the clinician. But certainly, I know that's a big part of this second course is that understanding how those two work together. So, yeah, I'd love to have you share a little bit about that course as well.
Yeah, so we've been planning kind of for a while on how to really help clinicians because there's two major lifts that people have to do. The first big lift is treatment planning. And we hear a lot of people go, oh, Spear needs more digital in their treatment planning. And I said, wait a minute, what did you just say? Treatment planning is neither digital nor analog. Treatment planning is cerebral. It's our thought process and evaluation process and talking to patients about the dentistry that they need. So the treatment planning piece it's up here, right? But the applications then, when you understand where to put teeth and where to put tissue and kind of the planning process, there's digital applications to the treatment planning process. And that's actually the second course. It's really not going to be treatment going over treatment planning per se, but it's going to be using, it's all digitally based, from everything from exams to photography to that's digital smile design or smile cloud, some sort of digital aspect. So it's really geared towards the application parts of the digital into a digital workflow for the treatment planning process. So it's really a nice 1-2 punch, if you will, from here's the basis for how to evaluate, how to at patients, how to talk to them, and then here's the digital applications that give you the resources on how to now apply it in your practice. Because a lot of practices now are going almost fully digital, right? It's an interesting time to be a clinician because you have to decide where are you right now. Like for my practice, I practice with my wife, and we're in both worlds. We're in the digital world, we're in the analog world, and we choose which world to live in at which time, depending on the case. Because there are some things that I still prefer to do in the analog world that seem to make more sense. But there's an awful lot more things now that we're doing digitally. So it's like the digital applications for the treatment planning process it's a nice timing to be able to start running that workshop. That'll happen next year.
Yeah, and like we talked about with the treatment planning with confidence, same thing with this one. Some Monday morning applications, I mean, I think you did a really good job of kind of laying out those three specific things that they can, start to implement, like that framework. Same thing on this course, like any, specific takeaways, as part of the curriculum that they would be able to go back and implement.
Yeah, so we're going to do a lot with management of data. It's funny to me, and people say I'm a digital dentist, and I go, okay, what does that mean? Because you have a scanner, because you have a scanner, you're digital, and that's really what it comes down to. It's like, okay, well, yeah, I have two scanners in my office, so I'm double digital. No, what do you do with your data? Like, what do you do with that management, and how do you implement and start to cross the lines? The digital aspect of scan it, prep it, scan it, mill it, seed it. That's tried and true. That's not what we're going to be doing, right? That's kind of CERAC Doctor, CDocs has that covered. So it's more like you want to do more than single tooth dentistry. How is that going to be done? From acquisition of photography and scans and even CT, and actually layering that data. It's more towards a digital smile design, a smile cloud, some sort of how do you now change the aesthetics, knowing how to treatment plan it? How do you actually now start the waxing process? And then how do you come back into the analog world? What do you do with that data? Is it data just in the planning process, or is it data now that's used with articulation, that's used on the treatment process? So it's really starting to cover all of the nuances of practicing dentistry, but in the digital world. It's data.
Yeah, and the other thing I wanted to ask you as well is, I was curious your perspective. We think about both of these courses. How are things changing, Gregg, with patients? So the first question is, when I think about the second course, technology, patients now looking for practices, or are you hearing from attendees at Spear and even what you see in your own practice that patients are looking for practices and looking for clinicians that are folding in these technologies into their practice? It's like, has there become an expectation where they know that the clinician they go to are using these technologies? I'm curious on your perspective on that, because I think that that's just another reason, right, to be able to, like you mentioned, learn how to integrate these into what you're doing. Perception could be reality from a patient side. So what are your thoughts on that?
Yeah, I think you're right. I think the biggest, patients don't know what they don't know. So depending on who their dentist is and where that dentist is with technology, they might not know. But once they start talking to a friend who has a dentist that's, I don't have to put that goop in my mouth anymore. They scan me. You're like, what? I want to do that. Like, that's the people hate impressions. And so Yeah, I think patients now are starting to be discerning and looking for clinicians um, where their experience is different, right? Where they don't have to do some of the things that they disliked in practices before. They might be able to offer things that they didn't have before. So yeah, I mean, I haven't read a paper that says, they've surveyed 100 patients and 100 patients are looking for this, but I think you're right in that patients do want their clinician to be more modern and up to date.
Yeah.
Because we've seen a lot of patients coming into our practice, um, well, their dentist retired and they've been in practice, however many years, and maybe didn't implement anything digital because you don't have to be digital to do dentistry. And so now they're just kind of blown away when they see that there's something else to offer.
Yeah, no question. It's exciting. And like you mentioned, knowing and understanding how to integrate all that into your practice just boosts your confidence. And then, like you mentioned, really helps with, case acceptance and all the like. I wanted to wrap with, having you talk about 2024 just in general when I think about, campus and there, at the Spear Institute. And I think what you're excited most about. I mean, these two courses alone, I feel like what a great way to start out the year, for clinicians to get ahead and to get some great education. But when you look at 2024 in general, at campus, like what are you excited most about?
I'm excited about these two. So you're right on that. The other big piece I'm excited for, when COVID hit, we had a lot of ways that you could get information, and we had something that we called seminars. And seminars were big, large, very large in-person learning events. They were 2 days, and it was like 300 people. We have a huge auditorium on campus, and they were fantastic because it hit all of the different topics of dentistry, from treatment planning, occlusion, implants, airway, you name it. And there is a seminar that has kind of a 2 days of didactic. We have really not brought those back since COVID, where everything went digital, and people are like, oh, I love digital. I never have to leave my home and I can sleep in my own bed. And I think we're now where that virtual Zoom type meeting, well, at least for me, and you're probably the same. It's like, well, if I can go around people and be around people and learn, I probably will learn better because I don't know, there's too many distractions. I have my phone, I got my computer. So if I'm trying to watch and learn something, it's like I'm going to be drawn in a million different ways. But when I'm on campus, I'm in person, then it's different. So we're bringing all of our seminars back to in-person events, and all of the faculty at Spear have been really excited for the day that we're finally told, okay, we're doing it. We're bringing them back. So I think that's the coolest thing for me is I've missed them. I've missed having large in-person events. So those are coming back as well.
Yeah, that's very exciting. And for those of you that have never attended Spear in Scottsdale, like I've been there, and like you talked about it, Greg, inspiration and aspiration, right? I think just being in that auditorium is pretty magical, right? I feel like you walk in there and you want to learn. So yeah, no question. I think getting back together in person and taking things to the next level, and I almost feel like the timing, right? Like it feels like there's such exciting times in dentistry when I think about, just hearing you talk about a lot of the younger dentists being excited to learn and want to get ahead and be better dentists. I mean, that alone, I think, is very exciting. And I'm sure it is for all of you. So this has been excellent. Thank you so much. And again, for anybody that's watching this, the Spear team is going to have all the information about the two courses that Greg mentioned and how you can register for them and get all that information and all of that. So, any last thoughts as we wrap?
No, John, I appreciate your time this evening. It's been wonderful to talk to you. Hopefully, our paths will cross in person again in the near future. But I appreciate the time to be able to talk. Thank you.
Absolutely. Have a great night.
All right, you too.